Hi everyone, Dr. Demetrios Kydonieus, chiropractic nutritionist here. I want to take about 5 minutes to explain exactly what chiropractic is good for and when you should go and why you should consider a chiropractor a lot of times over going to the physical therapist, the orthopedist. So basically, most of you have encountered probably a back pain or a neck pain. You might have been to the chiropractor already for one of those situations. That's kind of what everybody knows, is that chiropractic is great for low back pain. Chiropractic is awesome for neck pain or cervical spine pain. That's what the scientific research proves, that chiropractors are the best at treating the spine, especially low backs and necks. Okay? The reason that works is because what chiropractors do is they analyze your spine, they find the misaligned vertebral segment right here, and they realign it with an adjustment. Now, an adjustment can be done with hands. I can push those bones back in place with my hands placed in a specific manner, or I can use a little instrument like a little thumper with a rubber tip that moves super fast, so fast you don't feel anything. And when we do that, we realign the vertebral segment, we make the joint work better, so the joint pain goes away. The potential for arthritis goes away because now that joint's not rubbing abnormally, it's back in its normal or healthy position. And the most important thing to consider here, though, is by fixing or realigning a joint of the spine, what we're doing is we're removing pressure off the spinal nerve. That spinal nerve comes from your brain out this segments right here, and it controls a set of tissues. That control is going to be for your intestines, it's going to be for your heart, your kidneys, your pancreas. It's going to even tell your immune system how to fight an infection. The messages from your brain have to travel down the spinal cord, out the telephone lines as I call them, or the spinal nerves, to every tissue in your body. Every cell in your body is controlled and gets its orders from your nervous system. From your brain through your nervous system. That's why chiropractors are really a lot more than just back doctors. We affect every organ, every muscle, every immune cell in your body. We can affect circulation. We can affect digestion. We can affect heartbeat, blood pressure, kidney flow, hormone reactions with, whether it's male or female hormone reactions. I'd like to say basically chiropractic can have a positive effect on your happy parts, the reproductive system, whether it's the male genitalia or the female genitalia. You're going to have better regulation of all those parts if you get your spine checked to make sure that there's no misalignments. In chiropractic we call it misalignment, a subluxation. A subluxation means a bone that's misaligned in the spine that puts pressure on a nerve, causing interference with the communication of nerve flow. Just the weight of a fly or the weight of a dime on the back of your hand will reduce nerve impulses through a spinal nerve by 60%. That's been proven in the scientific literature for over 30 years now. Chiropractic, very beneficial. So all of you are going, great Dr. D, I go to chiropractor when my back hurts and I get it fixed, my back feels better, and I say, bye, see you, I'm out of here. What you want to understand is that it took many, many months, even years, for your problem, your spinal problem, to become painful. Pain is the last thing in a disease situation to show up, and it's the first thing to leave. What does that mean? That means you've been sick a long time before you're consciously aware, before you can feel it. So getting your spine checked when you have minor misalignments that are not causing pain can actually be preventative and keep the nerve energy flowing much more freely without interference. Therefore, your brain will be able to regulate your hormones, your blood flow, your muscle tone, and everything in your body normally, and not ever break down and become painful and then become diseased. When you're diseased, obviously, it's a medical condition. That means you've had a problem for a long time and you've ignored it. Now, the other thing to understand is since chiropractors are so good at realigning joints in the spine, chiropractors can align any joint in the body. Chiropractors are great for torn rotator cuffs. We're wonderful for tennis elbow and elbow issues. We do awesome job with carpal tunnel. If you've been typing on a keyboard or you've been texting and you have text thumb, we can adjust your wrist and your thumb and get it actually back to normal, therefore feeling good. Chiropractors are wonderful for hip trouble and torn ligaments in the knee, meniscal tears, sprained ankles. Anytime there's a a joint misalignment or a joint pain or a joint injury, chiropractor is going to be your number one choice, because if you think about what we do compared to physical therapists, would be the closest, is that physical therapists are awesome and I love them, and they just work on muscles and ligaments and getting your strength back. They do a little bit of neurological coordination if you've been paralyzed and you got to learn how to walk. That's when you need a physical therapist. They're great for that. Chiropractors can also do physical therapy depending on how extensive their office is. But at a chiropractor's office, you will get the muscle and the joint rehab, but you'll also get the realignment, the adjustment, the spinal adjustment that only chiropractors are licensed to do as healthcare professionals here in the United States. So when you go to the chiropractor, it's kind of like one-stop shopping. You get the benefits of neurological correction by taking pressure off the spinal nerve, and you get the musculoskeletal correction by rehabbing the joint alignment, which is going to also help muscles and ligaments heal faster. So chiropractic is not just for back pain, not just for herniated discs, or not just for headaches or neck pain. Chiropractic is for injured knees. Chiropractic is for injured ankles, hips, numbness and tingling in any of the joints. If you have abnormal posture and your posture is really off, that's a sign that your spine is misaligned, so you need a chiropractor. No other doctor, medical doctor or physical therapist, is going to be able to fix that. Orthopedists are wonderful, but orthopedists do surgery. They get you when you have such a bad injury, you need somebody to go in there and sew it back together or put pins and screws to realign a broken joint or a broken bone. That's an orthopedic thing, not a chiropractic thing. And they do great at that. But when the everyday aches and pains, the slow degeneration, and the weakness in your nervous system is actually a chiropractic specialty. So hopefully this helps you understand what's going on. Look forward to seeing all you. Have a great, wonderful, happy, healthy, wealthy year. And this is Dr. D signing off. And as you can tell, I'm doing this recording around Christmas time. Have a wonderful holiday season. Bye-bye, everyone.